Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In the hepatocellular carcinoma, we have a staging system called as Okuda system for staging. So we have an Okuda system for staging. So in the Okuda system for staging, we have four clinical parameters. What are they? We have serum bilirubin, serum albumin, tumor size and ascites are important points about Okuda staging. And if serum bilirubin is less than 3, then 0 points are given. If serum bilirubin is more than 3, 1 points are given. 1 point is given. Then if serum albumin is more than 3, 0 point is given. If serum albumin is less than 3, 1 point is given. Tumor size. If tumor size is less than 50, 0 point is given. If tumor size is more than 50, only 1 point is given. In ascites, if it is absent, 0 point is given. If ascites is present, then you give 1 point. And if you add these all, you get a maximum of 4 points, right? The patient is said to be in stage 1 if he has 0 points. Then a patient is said to be in stage 2 if he has 1 to 2 points. If the patient has 1 to 2 points, then it is stage 2. Then the patient is said to be in stage 3 if he has 3 to 4 points. So 0 points stage 1, 1 to 2 points it is stage 2, and 3 points 3 to 4 points it is stage 3.
Thank you and thank you for watching.